I'm Andrew Grose. I'm the orthopedic trauma director at HSS Stanford, and I also do some joint replacements. Most of my practice here at HSS Stanford is people that have had fractures and either been discharged from the ER or admitted with severe trauma, or an elderly patient with a slip and fall who can't ambulate. So orthopedic trauma, I would say, has a narrow and a broad definition. The narrow definition is you're broken and we fix you. And the broad definition is, how do we restore your functionality as a person, as the person you want to be in terms of what gives your life joy and meaning. So when a patient comes to see me, first rule is, especially the first visit, they should feel like they get to discharge me. That they have all the time they need, especially when we're getting to know each other, in the vein of, you didn't plan your traumatic event. You need to have all the time it takes to be sure that I'm the person you want taking care of you. That's really my biggest goal. And then that also gives me a lot of time to understand who you are, what it is you want from me, what's attainable and what's not. A lot of that is, I have a lot of education to do on what the injury is and how it can impact you, so that you're empowered to make some decisions. There's nothing better in my life than when somebody comes back to the office that I initially only saw on a stretcher for days, or even were wheeled in on the stretcher for a couple of months because they have so many traumatic injuries, and they walk, and that's why you do this.